diagnoses pelvic floor dysfunction is the subject of this video. In this video, I'll be going over some of the symptoms that you may have related to pelvic floor dysfunction that you may not have related to pelvic floor issue, pelvic floor dysfunction issue, and then explain to you some of the things, some of the providers, different providers you need to see or you might have seen, and then who to look for help resolving this issue. So here is the pelvis. It's the foundation to the structure above. Your pelvis has double layering, double reinforcement of the walls of the pelvis. And the reason you have double reinforcement is because the foundation of any structure needs to be nice and strong, or the structure will not withstand instability or challenges in life. So you have these muscles on the inside that work with the outside to stabilize the pelvis. Your pelvis stability, let's just start by saying your pelvis is consisted of two bones or three bones, two big ones right here, and your sacrum. They form two joints back here and one joint up front at the pubic area. Then there's your spine that's connected to it and your lower extremities that are connected at the hip joints. So you can have instability within the pelvis at the three joints that I mentioned that belong to the pelvis itself, and then where other parts of your body are connected to, like your lower extremities or your spine. So any issues related to your spine or structure above or the lower extremities can easily impact the stability of the pelvis and lead to the malfunction of the muscles inside. It's not a malfunction in a way, it's a planned change of function, because the whole goal is for you to live a long life. And in order for you to live a long life, you need to be able to sustain yourself. So the change in the behavior and existence of these muscles is necessary for your today become tomorrow. The problem rises when the modification of its presence now impacts your internal organs, the nerves, the blood vessels, and whatever structures that are connected to it. And most often, it is the pain that basically forces you to go seek a provider's advice or a change in your lifestyle that you simply don't like. Typically, depending on the symptoms, you may go see a urologist because the impact of this change in behavior and pelvic stability may have impacted your bladder. It may have impacted your intestine in the form of constipation typically, or having to go to the bathroom. The stool is not hard, but you have a hard time passing stool. The sphincter simply doesn't open or closes prematurely. Same is true with the bladder. And in the process of doing that, if you're a male, typically they look at your prostate, and no matter how old you are, they say, oh, you've got inflamed prostate. Of course you're gonna have inflamed prostate because everything inside is being squished in and being inflamed. Now you may have nerve-related issues, so this is when you may have seen physical therapists or chiropractors for, let's say, lower back issues, sacroiliac joint pain, or maybe mobility, lower extremity issues. You may have seen them, it might have gotten better, but it's still there. Finally, after you've tried so many different things, different providers, now, by the way, if you're a female, you might have seen a gynecologist for the uterus related issues. And then they examine you and say, you're tight. The muscles are tight on the inside. If you're a male, they go through the anus to feel the muscles inside and say, that seems to be tight. You need to see a pelvic floor therapist. So then you end up going to see one. Most pelvic floor therapists are physical therapists, but not exclusively. There are chiropractors, there are nurses, there's nurse practitioners, there are other physicians, though I've never seen a physician that does pelvic floor therapy, but I've seen all different kinds of other providers I just mentioned that are trained in the field of pelvic floor therapy. I, for one, I'm a chiropractor, but I see many patients with pelvic floor dysfunction, and frankly, the last thing I do is to go inside through the vagina and or anus to assess the muscles inside. Why is that? Because I know these muscles are not just randomly going against the body. They're behaving according to what we now need to discover what it is, to remove that and to change the environment that then allows these muscles to go back to the original plan, because that's what they want to do anyway. Going on the inside, to me, is like having a disc issue and thinking getting massage is going to cure it. Does it help? Sure. But the moment you get off the table, you're back to square one. So when you go in, you'll say you have tightness of these muscles and we're addressing it manually, digitally, then what exactly are we doing? Then there are exercises that are provided to the patients, which from my perspective are pretty generic. Let me explain. Your body works as a unit. When we give exercises for the pelvic floor, we are disregarding what this poor floor is doing as a result of what's happening or not happening enough related to the pelvis. So when we isolate a body part and try to strengthen it or stretch it, we're mistaken, in my opinion, because you are never isolated as a body part. And the stretching is going to help the tightness, but the tension in the muscle is never understood why it's there to begin with. Or when it's weak, is it weak because the body part is exhausted, or is it weak because it doesn't get a chance to work? Either way, it is not an isolated body part that we're dealing with. So what makes sense to me is to look at movement as developmental movement. Look at exercises as human movement exercises. And the only way we can understand that is by studying human babies. So to me, the right answer is always developmental exercises, because every single one of us that walk on the planet Earth, so we're not talking about United States here, we're talking about the whole world. Every walking human being started as an infant that could barely hold their head up, and somehow they became running toddlers. No bands, no gyms, no weights, no guidance. We're hardwired that way, and our body parts know very well what their function is and what their role in movement is. When we change the environment, we change everything. So that means the fix is not going to be a stretch, is not going to be some kind of a injection, is not going to be some kind of a surgery. It is going to be changing that environment, your current environment, and changing it to the right environment. We know what that right environment is. It's just that the provider has to educate you on you learning how to continue providing that right environment. It's kind of like driving a car. Once you learn how to drive a car, what the rules of driving are, you can drive anywhere in the world. The issue here is you need to learn. So who is the right provider? In my opinion, the right provider is someone who looks at the issue holistically, has the knowledge to review what has been done up to this point, and not be so focused on just here. The same provider then needs to be able to and be willing to teach you what he or she is looking at, what right looks like, what wrong or your version looks like, and how to have a critical set of eyes. So when that happens, you own the solution and you are much more educated in assessing your problem and assessing your life going forward. This is what I find to be helpful. This is what I do for my patients, and this is what I'm reporting to you as the most effective way to address pelvic floor dysfunction. I hope you found this video valuable. If you have not subscribed to the channel, please make sure you do. If you have any comments or any suggestions for any videos, please put them in the comment section. I review them myself, and I would love to hear what you think. Until next time, take care.